January the 4th, 2022, Tuesday. I'm going to ask you something really special right now before we go any further, because I've got 2 or 3 things to announce to you that almost seem like old hat. You know, the kind of things that have been going on, and we've almost grown numb about hearing this news. I'm going to ask you, please, right now, on Tuesday, January the 4th, 2022, to just remember just this. Even though these, and there's a lot of goodness here, but even though the goodness or the badness continues to happen, we should absolutely feel blessed in every way. You know, it's a new year. You know, God has given us this day. A day that we can see in lots of places a beautiful snow. A day that we can see a sunrise, a sunset, and the beautiful stars at night. An absolute gift from God. We should absolutely not take that for granted. Nor should we take for granted the things that are happening amongst our state right now. We lost another 25 people. Are we going to just say, well, you know, it's just kind of the way it is? Almost our entire state is red now. Are we going to say, well, just the way it is? Absolutely, without any question, I'm going to tell you about revenue numbers that are out of sight beyond belief. And our state doing so good, it's off the chart how good we're doing. Are we going to say, well, that's the way it's just been month after month after month? You know, I'm telling you, with all in me, you need to absolutely celebrate the good always. Be thankful to God above for this day, a gift from God. Absolutely remember all these people we've lost, and do not let this become old hat. Don't let this become something that you're just numb about, because it will not end well for any of us. Anytime we take good and we just take it for granted, or when we accept mediocre or bad stuff as the way it is, it's not what we ought to be doing. It's really not what we should be doing. So with that, I ask for your prayers for these 25. The 5,337th death, a 77-year-old male from Cabell County. The 5,338th death, a 60-year-old male from Jefferson County. The 5,339th death, a 72-year-old female from Ritchie County. The 5,340th death, a 69-year-old female from Cabell County. The 5,341st death, a 63-year-old female from Jackson County. The 5,342nd death, an 88-year-old male from Fayette County. The 5,343rd death, a 38-year-old male from Mason County. The 5,344th death, a 78-year-old female from Ohio County. The 5,345th death, an 88-year-old female from Kanawha County. The 5,346th death, a 71-year-old female from Cabell County. The 5,347th death, an 86-year-old female from Kanawha County. The 5,348th death, a 71-year-old male from Kanawha County. The 5,349th death, a 75-year-old female from Raleigh County. The 5,350th death, a 57-year-old male from Mingo County. The 5,351st death, an 87-year-old male from Hardy County. The 5,352nd death, an 84-year-old female from Greenbrier County. The 5,353rd death, a 73-year-old male from Raleigh County. The 5,354th death, a 74-year-old female from Lewis County. The 5,355th death, an 85-year-old male from Hancock County. The 5,356th death, an 83-year-old male from Hancock County. The 5,357th death, an 85-year-old male from Jefferson County. The 5,358th death, a 68-year-old male from Wayne County. The 5,359th death, a 77-year-old female from Jackson County. The 5,360th death, an 88-year-old female from Ohio County. The 5,361st death, a 77-year-old male from Cabell County. Now we're up to, of these deaths, well, it's still the same. 90% of them, 90% of these deaths are people that are unvaccinated. Active cases in West Virginia, get this number, 15,911. Positive cases, 2,353. The daily positivity rate, I've never seen this before, 20.74. Cumulative is at 6.63. Recovered cases, a little over 318,000. Now there's over 700 hospitalized in West Virginia, 716. 195 in the ICU units and 118 that are on ventilators. 84% of the patients that are in the hospital on the ICU units or in the ICU units are on ventilators. 84% of them are unvaccinated. Today in the state of West Virginia, like I've said, for all practical purposes, the whole state's red. The Omicron viruses now have jumped to 79 cases. We knew this was coming, did we not? Dr. Marsh has said over and over that this is coming. Is it not jumping? We have not seen the jump that's coming. It's going to get way worse than this. 22 school outbreaks, 15 counties with 272 kids. Now, like I said, are we just numb to this? Are we just numb to the fact that this is not good, but we're just going to have to live with the not good? We shouldn't do that. We should not accept that. We should not accept that this is just not good, and we're just going to live with it being not good. We can make it good. Absolutely, we have a choice to make it good, and right now the choice, the only thing we really got right now in the choice is really the vaccinations. But as we move forward, we hope and pray there'll be more things that'll come on the table, but the thing we got to do, we just got to say, we're not going to accept this. We're not going to just become numb with this. We're going to keep battling. We're going to keep striving to where this goes away. Now, on the good side, we just announced staggering revenue numbers. This state, my gracious goodness alive, you've got to at least give me this. You've got to give me that I'm a business guy. I can read a set of books. And from the day that we walked in here to imagine these kind of numbers, you know, absolutely people would have thought, well, good gosh, there's no humanly way that we can have these kind of numbers. But we're doing it. We're doing it right here in West Virginia. And you know what? Absolutely, West Virginia is now known across the globe as that diamond in the rough, a place to come to, a place to move to, an absolute diamond. So with all of that, imagine in 1 month, a surplus in 1 month of $124.4 million. Now, I'm not going to go through all the rest of the stuff and everything because you've already probably seen our press releases or whatever it may be, but I'm going to just say this. I'd bet you today, for the year to date through December 31st, the year to date for 6 months in the state of West Virginia, 6 months, we have a surplus of $393.9 million. None of us can even possibly equate to how much money that is, to absolutely what that's going to do for the goodness of this state. And that's 6 months into the year. So with that, we should do the same thing. We should celebrate this. We should strive to do even better. That would be great, but we should absolutely celebrate this moment. Shouldn't be something that ought to be buried on the last page in the newspaper or ignored. Absolutely, without any doubt, we should celebrate this. It is really, really, really good stuff. And we all jumped in, we all pulled the rope together. There's so many folks that are responsible for this goodness and everything, and I am just honored to be one pulling the rope with you. You know, along the way, now let me jump back to maybe not the great side. Along the way, we make provisions, do we not? Just in case we get overrun at our hospitals and we're understaffed in every way. I want to read a little bit to you here. The West Virginia National Guard will have 37 combat medics undergoing recertification training starting this weekend. Now, we're not just doing that just to be doing it. Absolutely, without any doubt, our people are doing these things and making these moves on the chessboard to protect you. But did you hear that the National Guard will have 37 combat medics undergoing recertification training this weekend? And they're doing that in order to be sure that we can cover, you know, a run on the bank with our hospitals. And so, with all that being said, you know, I'm going to read the rest of this to you. This is an annual requirement and comes at a pivotal time when the National Guard and our COVID task force are looking for any potential need at our local hospitals. I have authorized the National Guard to build out to 600 personnel of our COVID task force, and they are currently working to identify any additional medical assets who can assist if there is a need. We have also identified teams of liaison officers to go to hospitals to assess needs. The Guard will be conducting training of more than 350 personnel to ensure that there's available people if we have to deploy these people to the hospitals. Are we going to be numb about that too? Are we going to just think, well, you know, what the heck, let's just go to Wendy's or whatever it may be, go on about our lives and everything, don't worry a bit about anything? You know, you've got the National Guard on high alert. You've got the National Guard that is deploying and trying to make sure that we don't have our hospitals overrun. The theme of this today should be, we're not going to become numb. We're not going to become numb about those folks that we've lost. We're not going to become numb about the fact that we've got 700 plus now in the hospitals. We're not going to become numb about fantastic revenue numbers. We're not going to become numb about the fact that the National Guard is on high alert to make sure our hospitals don't get overrun. We're going to react. We're going to react as West Virginians. And I ask you, whatever you do, don't become numb. Absolutely, if you do that right now, it is just a bad, bad move. I remind you about 65 and older. If you have any health condition whatsoever and you have any kind of symptom, anything, go get tested. The antibodies are out there and they'll save your life. I encourage you, if you're going into a crowd of people, you don't know the people and everything, think real hard about wearing a mask. If you're 65 and older and you've got any health conditions whatsoever. I tell you, in regard to the booster shot to me is the biggest. That's the biggest and most important right now. You know, all the rest of it is really important, but something's got to be the biggest, and that is, you know, now the FDA has gone and lowered the age on their boosters to 12 to 15. The 12 to 15-year-olds can now get their booster shot, you know, and I keep going back to the booster shot. The booster shot is so important, it's unbelievable, because people think, and they've gone asleep at the switch. It goes back to the numb deal. They're asleep at the switch because they believe they've been vaccinated and they don't need the booster shot. And by not needing the booster shot, they're really missing the boat, because all the experts are telling everybody, if you haven't got your booster shot and you're 6 months out on Pfizer and Moderna, or you're 3 months out on J&J, you really don't have much immunity to this at all. So you got to go get your booster shot. We're at 65.2% of all those 5 and older, 65.2% that have gotten one shot. That's really pretty decent. 71.4% of those 18 and over. 83.6% of the 50 and older, and 91.3% of the 65 and older have gotten one shot. Well, I'm a real believer, if you've gotten one shot, you're going to get the other. But here's something I really just don't understand. I don't understand this. In the state of West Virginia, we now have 327,000, a little over that, 327,000 people that have received their booster shot. 327,000 have received a booster shot. The other day when we were here, I think the number was like 319,000. You know, it's not enough. It's just not enough. To me, it's the most important right now. There's certain things in life that are the most important. This is. You got to get that booster shot. Young people, help us grandparents, help us parents to get them vaccinated. You know, we're doing better, but we're not there. All the COVID vaccine stuff is up there on the website. All the free testing stuff is out there and everything. We need you to take advantage of that. I continue to thank Frith and Walgreens for all the good work they did and continue to do. We've jumped significantly here. We've got 79 outbreaks in our long-term care facilities. We've got 1 outbreak in our church communities, 101 inmate cases and 81 staff cases. We've really jumped right there. I remind you about your flu shot. You can take it with the COVID shots. I remind you about the rental assistance program. Over and over and over, I tell you about the rental assistance program and everything, because there's real dollars there that can come to renters, and there's real dollars there that can come to landlords as well. You need to call us to check out and see if you can qualify. If you can qualify, we want the money in your hands. Absolutely, it turns into a multiplier effect for all West Virginians. And so, nevertheless, if we can get you qualified, we really want to get you qualified. And last but not least, another issue, giving blood. Really and truly. When I say it, do you just say, oh, well, we've heard that before? Is that really and truly what you should be doing? Especially if you have recovered from COVID, you are a blessed individual beyond belief. If you've not gotten it, a blessed individual beyond belief. You ought to really consider giving blood. There's folks that really, really need you right now. So West Virginia, keep together. Whatever you do, if I go out here today and get run over in the street, keep together. You have absolutely done marvelous work by staying together. You know, it's been tough. You've heard my words and you've trusted me, and that's what I'm going to do. I'm going to continue to come in all the time to you, and I'm going to pass on the truth to you. I'm going to tell you the bad stuff. I'm going to tell you the good stuff. I'm not going to ever try to scare you, but I can tell you this thing has not gone away, and it's right here with us, and you have the ability in lots of different ways to really, really help. Do that, West Virginia, and stay together. All right, that's all I got right now. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. The governor's made some very important points that I want to reinforce here briefly. So the Omicron variant is spreading around the United States and is growing in West Virginia. As a reminder, our last sequencing run last week detected 15% of the positive cases sampled as Omicron, the rest were Delta. And as we look around the country, we see, at least from CDC reports now, that about 60% of all the cases that they have been able to assess from around the different states have been Omicron, the rest Delta. So as we look at the situation we're in today, as the governor very correctly said, we yesterday saw a number of new cases in the US shatter every record by being over 1 million new cases of COVID-19 detected in the US yesterday. And that was compared to a previous high of 303,000. As we look at the issues that we're seeing around the country, there's several important and concerning parts of this. The first issue is that we see today in the United States more children hospitalized with COVID-19 than we've ever seen before. And as we start to understand Omicron a bit better, although it does appear from other countries that at an individual basis, Omicron may lead to less severe illness, particularly in adults, because Omicron may have a predilection for the upper airways and the bronchi, as opposed to the lower airways and the air sacs, where oxygen is transferred from the air to the blood. And as we look at the Delta variant, we know the Delta variant had a higher predilection for the lower airways and caused a lot of problems with oxygen exchange. And people ended up being very low in their oxygen levels in their blood. Whereas in the Omicron variant, it appears that this variant may very well multiply in the upper airways and the bronchi. And that may be the reason why we're seeing so many hospitalizations among children who are dealing with respiratory problems in their smaller airways. And so as we look at children, we know that their airways are very much smaller than adult airways, and that makes them more susceptible to infections that really target that part of their lungs and can cause more inflammation and more narrowing, which makes it very hard for them to breathe through. And that's what we've seen in a small percent of children who have been infected with COVID-19. But as I say, more children hospitalized today in American hospitals with COVID-19 than ever before. And the risk of unvaccinated versus vaccinated, unvaccinated 12 to 17-year-old children are 10 times more likely to be hospitalized than vaccinated children. And importantly, as the governor said, the FDA has just approved a booster dose in the 12 to 15-year-old age group with Pfizer. And that is important because we know that the potency of these vaccines does wane after the second dose. So giving these children an opportunity to be vaccinated and boosted is really important. And note that the lowest group in the country vaccinated proportionally are children in this age group and younger. So really important for us to target this group with choosing vaccinations. And as the governor said, the FDA gave emergency use authorization approval. Now we wait for the CDC and the Advisory Committee on Immunization Practices to give their thumbs up. So by Wednesday, we should be able to offer booster shots to 12-year-olds and older Americans who are 5 months or more after their second vaccine, which is another change. So instead of 6 months, now it's 5 months. And the FDA also granted approval for any young people 5 to 11 who are immunocompromised to be able to get a third shot at least 28 days after their second shot, because they may not respond as well. So we know that children need to be protected. In West Virginia, we at this point have 11 children in West Virginia hospitals, which is not a substantial jump from what we have seen in the past week or few weeks, but we keep a very close eye on that, and vaccination and, when available, boosting will be an important strategy to protect our children. We also see more Americans in hospital beds than we have since September 11th with 103,000. Our all-time record is 144,000. And so we know that COVID and the Omicron variant has not finished spreading to more rural parts of our country and has not yet peaked in many other states. So states where they've seen Omicron start to grow have seen an increased number of hospitalizations. And that's likely due to just the mass number of people that are infected. And as the governor has rightly said, the majority of people that end up in our hospitals are people that are unvaccinated and importantly, and or unboosted. So it's really important for us to target those two strategies. The last thing I would say is that, as the governor said, this pandemic has gone on for a very long time. And as people are tired of dealing with COVID and tired of hearing from many of us, a number of concerns that we might have looking at the future and looking at what's going on around the world, our very strong hope is, as Americans and West Virginians and world citizens continue to gain immunity from immunizations and boosters, that we will be able to start to see this pandemic move from pandemic to endemic, as we see with other infections. But that is really in our hands right now. We do have tools to treat people, but we need people to be tested and to contact your primary care provider or your healthcare team if you are positive, so that your risk can be assessed to see whether or not some of these preventive treatments that we have, the monoclonal antibodies, the antivirals, remdesivir, the two oral medications, Paxlovid and molnupiravir, and also convalescent plasma, as the governor has asked for. And the Red Cross would particularly be looking for people that have recovered from Omicron who have been previously vaccinated. That gives the best antibody levels, which can be used to prevent others from getting really sick with this virus. Lastly, Israel has moved now to offering a fourth booster dose or a fourth vaccine dose, a second booster dose to all Israelis over 60 years old or Israelis that are immunocompromised at any age, or people in nursing homes. And they are doing this based on data that they report internally, which shows a threefold increase in the risk of infection in people who are past 4 months from their previous booster. So that's something else to watch for. And I think we'll be seeing likely another booster shot start to become a topic of a lot of conversation in our country. Thank you very much.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. I'd like to provide a couple of points to reinforce the governor's earlier message that we can't accept mediocrity and we can't go numb to this. And I'll start with antibodies and antivirals. West Virginians need to understand that antibodies and antivirals take time to produce because of the way they are produced. And right now, nationally, the supply chain is not keeping up with the needs for those. And therefore, in West Virginia, we do not have significant available supplies. As a matter of fact, we have about half of what we ask for, get about half of what we ask for on a regular basis. Number two, hospitalizations. The governor pointed out numbers today, but also want to point out that in addition to those numbers provided, we had 81 new patient admissions for COVID based on today's number. We also now have, I believe, 11 pediatric cases in our hospitals. So over a 7-day period, we've seen a net increase of about 144 COVID patients across our hospitals. So we see those numbers changing. And while Omicron and many individuals may be less threatening because of the significant increase in the number of cases, even though the percentage with Omicron may be smaller, the net numbers going into the hospital are going to be much higher. I heard a message yesterday that one of our health systems is 1,000 procedures behind in care procedures that are needed for West Virginians. So what I'd like to try to reinforce to the governor's point about us not accepting mediocrity in this, I'm born and raised in this state. I know what West Virginians are like and what they stand for. They're not just about their own individual rights, but they're about taking care of their fellow West Virginians. So the point I make to you is the only viable thing that we have available to us right now is what I refer to as a preventive treatment. And that is to take the vaccine and to get fully boosted, because that's going to allow us to address the challenges we face, particularly with our hospitals. The bottom line of where we're at right now, West Virginia, is unvaccinated West Virginians are delaying critical care for other fellow West Virginians. And we've just got to understand that is the bottom line as to where we're at, and goes to the governor's point. We can't accept that. We can't accept mediocrity. We've got to look at this as not just getting vaccinated for ourselves and for our own health, but we could potentially be causing someone else to not get a colonoscopy, who then could not get cancer treatment in time. So again, I like just to reinforce the governor's point. We can't accept mediocrity. We got to take care of our fellow West Virginians. And the best way to do that is take that preventive treatment, which is a vaccine. Thank you.
Thank you, sir. Next to Dr. Anamjad, our State Health Officer.
Good morning. I just want to remind everyone that if you are tested positive for COVID-19, we have such a large case volume over the last couple of days that our case investigation contact tracing team may be sending you a text message if you have a cell phone. So you might not get a phone call anymore. And we recommend that if you receive this notification, that you self-isolate for 5 days, make sure your symptoms are free, and also notify any close contacts in your household or even at work to go get tested. Thank you.
Thank you, Doctor. Next to Secretary Bill Crouch with the DHHR.
Good morning, everyone. As the governor said earlier and says in every press briefing, please get tested. If you have symptoms of any kind, or you're just concerned that you've been in contact with someone who had COVID, please get tested. This is important to reduce the spread of COVID in West Virginia. West Virginia has been in the lead, in the top 10 or 15 in the country in testing for months and months and months. We do a good job at that. Those numbers tend to go up and down, especially over weekends. We have testing available in every county. Sometimes those locations change, but we try to keep those testing sites operational all the time for folks. As a part of the commitment to keep our school-age children safe, DHHR is coordinating a COVID-19 testing event for children and their families as they return to school from winter break. Those are at various locations throughout the state. So please check the website for those. The information is posted on the website. We can take action to limit this spread. It's crucial to get vaccinated, as the governor and Clay and Dr. Amjad and Jim say constantly. We must get vaccinated, but as the governor talked about earlier, if it's past 6 months that you've been vaccinated and you haven't gotten your booster, you are in danger of acquiring this disease. So please protect yourself, protect your families, get vaccinated, and get boosted. Thank you.
All right, thank you, Secretary. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask if the state has any way to monitor or estimate the results of at-home testing. I know more and more people are relying on at-home testing. Those folks aren't going into our active case count. So I was wondering how we were planning for this unknown number and if that is resulting in an undercounting of our active cases. Thank you.
Dr. Amjad, please.
Yes, Governor. Charles, that is a good question, and you're right that the at-home tests that people are doing, which are accurate about 85% or so if you're at least symptomatic, they're not going into our public health investigation pool, and due to that, we could be undercounting. But that is also something that I think puts in the people's hands at home to get tested right away, especially since testing lines have long numbers right now. But If you test positive at home with a home test, we encourage you to follow all the CDC guidelines of isolation, to contact your provider. But unless it's done by a healthcare provider, a rapid test or one of those, it can't be counted as a real one either. It has to be verified. So if you get one at home and you want it verified, we encourage you to go to our testing sites to get one as well.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking a moment. Happy New Year, Governor, and panelists and fellow media members. And if you're watching, let's hope 2022 is better than it has been the past couple of years. Kind of a two-tiered question here, so bear with me for a moment. Omicron is showing, at least to the data that we have available, as Dr. Marsh said, that it settles generally in the upper airways and in the throat. So while it's 140 times more infectious than the Alpha variant, the first wave that hit, and about 70 times more infectious than Delta, it is having more flu-like outcomes than those two previous strains. With that in mind, even though the numbers are jumping, you can't fight a forest fire on every front with the exact same intensity. So what now is our priority? Is it managing hospital space? Because that seems to be the code red on top of many people's minds. Or is it booster shot campaigns? Or is it first shot campaigns? Or is it for young people? So where is the tip of the spear? That's the first part. And for the second part, I don't know who can answer this. Maybe General Hoyer, maybe Dr. Marsh, maybe Dr. Amjad. How many people are getting their first vaccine shots even as late as today? When we talk about people that are getting shots, how many are getting boosters? How many are younger and getting their first shots? But how many are of the older age, which have been eligible from the very beginning and are getting shots that we're seeing out in the field? Is it a significant number, or is it just a population that hasn't gotten the shot yet that's pretty much not going to get a shot? I know those are two very different questions, but if you guys could address them, I would appreciate it. Thank you very much.
Kenny, thanks a bunch. I'm going to defer to Dr. Marsh on the first part and General Hoyer on the second part. But before I defer, and I don't say this, this is going to sound like a smart aleck, and that's the last thing I am in the world. But Kenny, you say, well, what is the what's really the focus of the effort? What's the primary focus? Well, and I said earlier that you got to have something that's a primary, that's for sure. But just think about this just 1 second. If we dial into absolutely nothing but the boosters, and we really not nothing but we just dial in the booster, then the general public is going to absolutely believe that that's the most important thing. And what we really need to do is we really need to dial in and concentrate on the booster situation. And if we don't watch out, we're going to lose our way, and we're going to be overrun at our hospitals, and we're going to have a real big time issue there. Or maybe it's our children. So really, when it really boils right down to it, we can have primaries. We can have the biggest, but at the same time, we can't lose focus with any of this. This is almost like, and I led off by saying the smart aleck thing, this is almost like the snob guy that's sitting in the restaurant and the waitress comes over and says, "Sir, do you like your eggs scrambled or fried?" And he looks at her and says, "Yes." Well, think about it. Just think about it just a second. We have got to absolutely look at all this stuff and say yes, because you've got to keep all these balls in the air. You can have a primary, and I know that's exactly what you're saying, but you can't lose focus with any of it. You can't lose the steam with any of it. But Dr. Marsh, you take over, please.
Thank you, Governor, and thank you, Kenny. Kenny, the governor, I think, has really answered the question. Our primary goal in this entire pandemic response has been to save lives and to promote and maintain well-being of our population. And we know that the best way to do that is to really encourage people to choose to be fully vaccinated And now we know that it also includes people to be fully boosted. If we look at the numbers that the governor mentioned today about the people who have been boosted, who are eligible for the booster, who have finished their 2 vaccinations, and look at our entire population, only about 18% of our entire population has been double vaccinated and boosted of the people eligible, which is way too low. And we know that low number predisposes our citizens, now including our children, to be at risk of severe complications of COVID-19, which include hospitalization. And we know that hospitals are really under a lot of challenge right now because of staffing issues and because of the level of severity of the previous surge with the Delta variant, which has left a lot of people still in the hospitals of our state and our country. And we know that having another surge will increase in the mortality rates for not only COVID patients, but for people that need other treatments, like treatments for heart attacks and strokes and other things. And if we look at hospitals in northern Italy at the beginning of this pandemic, we saw that mortality rates at these hospitals in northern Italy that were overrun with COVID initially went from around 2-3% to about 15%. So we are very much focused on saving lives and improving outcomes by focusing both on the vaccination and the boost, super important at the individual level to reduce people's risk of severe disease, hospitalization, and death, but also to try to provide and maintain capacity in our hospital, which has to be part of that same thought, because if the hospitals get overrun, people not only die of COVID and have worse outcomes, but also from a number of other acute and chronic medical conditions. And I'll turn it over to General Hoyer for the second part.
I think, wait just one second, sir. I think maybe I can, maybe you can add to it after I get through here, but I may be able to take the second question and everything, but, or second part of the question, but there's roughly, and this is dropped down, and there's times when it goes back up and everything, but right now we're pacing at about 1,000 new people a day that are coming and getting their first shot. Well, just think about it. We'd like it to be 25,000 people a day or 20,000 a day or 10 or 5, but it's 1,000 people. 1,000 people a day are coming and getting their first shot. Well, just think, how many lives are we saving? I mean, pick a number. Is it 100 or is it 10? How many lives are we saving? But it is absolutely significant, is it not? As long as we can absolutely make that level of impact, and we want it to be a whole lot more, it's frustrating as it can be. For me to be here day after day after day after day, and I want to be absolutely with you, but it's frustrating and it's hard, is it not? But at the same time, we're doing good work. 1,000 people a day are coming and getting their first shot. It's really, really, really significant. So, General, maybe you can add from there, but I just want to throw that in.
Yes, sir. So, Kenny, just to reinforce the governor's point, we've never hit a plateau where we just flatlined on people getting vaccinated, particularly over the age of 18. So we continue to see about that 1,000 equates to about a 0.1% increase a day. So people are continuing to get vaccinated, and we're continuing to save lives in that regard. To the point on hospitals and capacity, we're now not focused on number of beds. We're focused on the capacity that we have available to provide care, meaning that if you have a staffing shortage and you can't put people in beds and you don't have the qualified staff to ventilate a patient, we have a challenge. So as the governor points out, we've got to manage multiple lines of effort at the same time. And we continue to try to do that based on the guidance and direction that he gives us.
All right, thank you, Kenny. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams with Ogden Newspapers here. In your conversations with the Hospital Association, do we know how much of these hospitalization numbers are people being admitted versus people testing positive while at the hospital for something else? Because I've noticed that the ICU numbers typically follow the spikes. You know, they followed the spike, in January last year, they followed the Delta spike, but the ICU numbers don't appear to be following the spike we're seeing right now. Maybe there's a delay. Are the people simply testing positive but showing no symptoms or mild symptoms, given that the evidence that Omicron is mild and isn't attacking the lungs like previous variants did? I mean, I guess my question is, are we admitting these people or once we find out they're positive, or are we just, unless they actually have serious symptoms that require being admitted, are we just sending them home? Thank you.
General or Bill Crouch, maybe one of y'all.
Yes, thank you, Governor. We don't have the detailed information, Steve, with regard to whether individuals obtain COVID in the hospital. Individuals in ICU tend to be hospital patients who get worse and then are moved to ICU as they have more difficulty and more serious symptoms. And of course, individuals who get placed on ventilators are those who get even sicker. So some of the hospital data is at the hospital, and it takes a little deeper dive manually to really look at that information and those patients. But we continue to watch those numbers and track those, and it's one of the most important things that we're following. As everyone's talked about, it's staffing shortages that are creating issues in hospitals right now. But we will continue to report those numbers daily.
All right, thank you, Steve. Next to Mark Curtis with Next Star Media.
Good morning, Governor and cabinet members and fellow reporters. First, a shout out, if I may, because I know most of the kudos are going to the public agencies, the state, local, and county officials dealing with the COVID response. But I want to mention a nonprofit that's doing a yeoman's job. I was at West Virginia Health Right on the east end of Charleston yesterday, where they broke a single-day pandemic record for testing with 827 COVID tests, 52 rapid tests, and they also vaccinated 41 more people. And I was at the West Virginia Health Right on the west side today, which is primarily focused on the low-income and minority communities. And I think we all know the minority testing and vaccination rate remains comparatively low to the rest of the population, and it's a concern. So just a shout out to Dr. Angie Settle, who runs Health Right, and her entire crew. They're doing a magnificent job on both the east and west sides of Charleston. Governor, my question is actually today about the revenue numbers. Nearly $400 million surplus for the first 6 months of the fiscal year. Is that going to shape in any way, to quote you, shape, form, or fashion, a personal income tax reduction bill in the legislature this year? I know you tried last year, it passed the Senate, and it did not get through the House. Are you going to try again? And can some of that surplus money, I realize about half has to go to the rainy day fund, but can some of the surplus money go for personal income tax relief, perhaps on a one-time basis or a gradual basis? And will the personal income tax proposal, if there is one, also include sales tax increases and another attempt at taxing broadcast advertising?
Okay, Mark, it's a big question. Let me try to address as much as I can. The ARPA, the American Rescue Plan, the dollars that are flowing to the states, there was a provision, and while Senator Manchin and I surely agree on what's going on today, that was a punch that we really didn't need to have happen across this country. But there was an insertion of language that basically said you cannot lower a tax and receive the dollars from the American Rescue Plan or the CARES Plan or whatever it may be. And so that's a real issue. Now there's states that are challenging that along with us, and so we've got to get through that before we can even begin to move forward. But in addition to that, to go on with your question, there's no doubt in my mind in any way that we've had two major misses in West Virginia. We should have tiered the severance tax on coal and oil and gas, and we should have done that for absolute certainty. That is a gigantic miss that we're going to regret for a long, long time. I tried it over and over and over, and we missed. You know, the other thing we should have done is we should get rid of our personal income tax in the state of West Virginia. With all of that, to be able to get rid of your personal income tax, what we really need to do is craft a bill at some point in time when we're able to do it with the ARP money and all that kind of stuff, you know, not being an issue, or the language. But when we craft it, here's how it should be crafted. You know, there's going to have to be, if you have a significant reduction and you pull all the state income tax out of the state, you have a big hole in the bucket. To replace that hole in the bucket, you're going to have increases across the board in things like sales tax or whatever it may be like that. But the net of the whole effort should be just this. Every single person across the entire state should come out with more dollars in their pocket. And if you can achieve that, it doesn't matter. If I hand somebody $100 over here and I take $30 from them over here, and at the end of the day they end up with $70 more in their pocket, that's what you got to do. And you got to do, and you can do it. There's a real way to do it. We had a way to do it before, but there's a real way to work through all those wickets and be able to do it. You can't just have a reduction in tax. You've got to have to where the outside world believes that you're going to get rid of this tax, because you're asking them to make a commitment and move here or move their businesses here. And so they have to believe you're going to get rid of this. You know, with all the good things that we have going on in West Virginia today, the one thing that we need more and more and more of is growth. It'll help our schools, it'll help our roads, it helps everything. We need growth. And if you'll just look at Tennessee and what's going on in Tennessee and everything else and the excitement, and we've got so much more than a Tennessee has gotten. You know, I mean, there's a thing that just came out, now I could be misquoting this, that West Virginia is in the top 5 places in the country that people are moving to, want to move to. You know, there is so many things that we've got going on right now. It would be something that I would surely support in every way, but right now, to be perfectly honest, Mark, I don't know that we can do it. You know, not from the standpoint of the great economic health of this state, but it really and truly boils right down to we're stymied by language in the ARPA bill that came out and everything, and that language is really hurting us, you know, from the standpoint of being able to reduce the tax. We got to get through that wicket, and then really and truly, we've got to get the legislature and myself all on board with the same message, the same effort. You know, to me, without any question, you know, I've brought us a long, long, long ways down the road, but two real misses that we have is the tiering of the severance tax on coal and oil and gas, and absolutely the miss on getting rid of our personal income tax. So, you know, we just keep moving, don't we? I mean, you know, those are misses. We just, you know, we just keep moving. But anyway, thanks for the question, Mark.
Thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, everyone. Just prior to this briefing, Maryland Governor Larry Hogan announced a 30-day state of emergency in Maryland because of the spike in cases, and he says it's going to get worse in the next 4 to 6 weeks. Governor, have you considered that, or does the latitude that you have with your joint interagency already provide the flexibility you would need to respond to the pandemic as it is forecast to be going at this point? Thank you.
Well, Paul, you know, technically we're still under a state of emergency, you know, but you know, our joint interagency task force is doing a magnificent job. You know, they'll make that recommendation to me. They're handling, you know, they're looking at every bit of this all along and everything. That recommendation has not come to me, and you know, we're handling this, you know, without mandates. We don't want to have mandates, and you know, so with all that being said, you know, I wish Maryland the best, especially those in Maryland that are deciding to move to West Virginia. You know, so we'll tell them to come on down.
All right, thank you, Paul. Next to Mark Cram with WDVM.
All right, Governor, I think we're seeing plenty of that in the Panhandle where they're coming across the border, and we appreciate it. The task force is doing a wonderful job. A couple of questions. One, when this virus first came out, we heard that there wasn't much in regards to treatment. Now we're hearing that antivirals like Paxlovid can be effective. Is that a light at the end of the tunnel? Is this showing that maybe this virus and its variants are becoming more susceptible to things like this, that we could get the upper hand? And we appreciate your comment in regards to not just going about our lives, but is it time to put in a mask mandate again, Governor? Thank you.
Mark, I do not think it's time to put in a mask mandate. I mean, for crying out loud, I am not, you know, I don't know how in the world we can, you know, flip up the television and see 65,000 people in a football stadium and everything, or whatever. I absolutely do not think we should put in a mask mandate at all. But Dr. Marsh, maybe you can answer the technical end. And Mark, you know, the best to all y'all up in Eastern Panhandle, and thank you for coming on.
Thank you, Governor, and thank you, Mark. You know, Mark, I think that the new antivirals that we're starting to see, including the Pfizer drug Paxlovid and the Merck drug Molnupiravir, as oral agents to deal with, you know, to reduce risk of people at higher risk of being hospitalized who test COVID positive, are steps that we are seeing that will improve our number of choices and number of options for people in the future. Just like we have for influenza A, we would like to have agents that we could give easily to people that would be convenient and in sufficient supplies, that for people that do have a breakthrough case or who are vaccinated who are not quite boosted yet, or people that haven't chosen vaccination that are at higher risk of being hospitalized because of age or coexisting medical condition, that having rapid testing capabilities, identifying these people early, because we know that these agents are best served when prescribed within the first 3 days or so of symptoms or positive tests. And so getting to the testing, defining this population early, and then intervening is really important. As General Hoyer said, one of the challenges we see today is there are shortages of these medications, and both of these medications are more complex to prescribe because of interactions with other drugs. And also the Molnupiravir works in a different way than the Paxlovid does, and may not be as safe for certain other populations. So these drugs need to be prescribed carefully with a doctor, and perhaps even with the consultation of a pharmacist. But these agents and more to follow will continue to help us in our hope to protect more and more lives and to promote more and more well-being, which helps all parts of our mission here in West Virginia. Thank you.
All right, thank you, Mark. Next to David Beard with the Dominion Post.
Oh, hi. We've already had some discussion about testing, and I want to continue with that based on some anecdotal stuff. I've walked into pharmacies and seen signs up, we're out of home testing kits, go somewhere else. And I'm picking up anecdotal reports from people of long lines at testing sites, multi-hour waits, and even people being turned away. So I guess the question would be, are we facing some kind of demand issue or supply issue with testing? And what do we tell people who are frustrated by the lack of access? Thanks.
General Hoyer, I think, you know, start off with the number of testing sites we've got and then go from there.
Yes, sir, Governor. So we still do have a significant number of testing sites, over 800 testing sites. We don't have an issue right now with the PCR test availability. And lines are certainly going to get longer because more people are going to get tested. We do hear on a regular basis that our local pharmacies and places that are stocking the antigen test do go through their supplies rather quickly and have some times to get resupplied. But I would encourage everyone to look at the DHHR site, look at where the free testing sites are, click on there, find the location next to you, and just be patient if there is a line. But there's plenty of capability across the state of West Virginia, and you can also call the hotline for assistance on finding the location as well. Thank you.
All right, thank you, David. Governor, I'll turn it back to you.
Again, and I'm just making myself notes. I listen to everybody. We've got an incredible team that has done phenomenal work. They continue to do exactly that. You know, a lot of the comments they come up with, you know, I jot down and you know, and reiterate. You know, I led off by saying this morning, you know, about not becoming numb, not becoming, you know, not accepting mediocrity. We've never done that in America. Just think about that. Americans never have accepted mediocrity, have we? That's what's made us Americans. That's what's made this incredible nation the very best, the very beacon of the whole world. West Virginia the same way. You know, why would we sit back now and just become numb to the fact that we're going to lose 25 to 100 folks every other day, and we're just going to live with it? Are you kidding me? That's not America. That's not us. The other thing I would tell you is just this, is I would challenge you to think just about this a second. What if the lines get longer at the testing places? What if you absolutely are not feeling very well? And maybe you're not vaccinated. And you think, dang, you know, I'm really feeling pretty rotten. And I really need to go get a test. And your family says, Charlie, you're not feeling very good. You really need to go get tested, and you need to go right now, Charlie, don't you? And all of a sudden, Charlie decides in his mind, you know, I really better go quick. And Charlie's not been vaccinated. But Charlie makes a decision then out of fear and concern and love for his family. He's got to go. He's got to go right now and get tested. And he rolls into his local pharmacy or local health department, and there's a line of 75 people standing there. And so now Charlie is standing out in the cold, and the wind's blowing, it's 3 degrees, and he's sick. He doesn't feel very good. You got to ask yourself, just ask yourself just this. Do you want to become Charlie? Do you want to be Charlie? Absolutely. I can't imagine it. And you can prevent that right now. Now, I'll end with just saying this. And I know that Mo won't care a bit about me talking about this. In fact, we've had this discussion. But Mo Ball, who is a really dear friend of mine, Mo's about 10 plus years older than me, and I'll let you figure it out from there. And Mo's in great physical shape. He really truly is. Well, just out of the clear blue nowhere, the other night, Mo ends up, we have to rush Mo to the hospital, and Mo ends up testing positive for COVID. He spent the night in the hospital and all the next day, and got feeling better, and they let him go. And Mo has quarantined now for the time period, but I would bet my life on one thing. He would tell you Mo Ball would not be with us today. He would not be with us today if he hadn't got his first vaccination, his second vaccination, and his booster shot. Mo Ball would not be with us today if he hadn't been completely vaccinated and boosted. I believe that with every single fiber in me. I believe that. And that's the risk you're taking. Don't be Charlie. Don't be Charlie that's unvaccinated and has got the feeling not so good, and he's standing out in the cold trying to get a test to see if he's positive or not positive. And don't be somebody that's not been vaccinated that's Mo, because Mo wouldn't be here. I believe that with all in me. That's all I got. It's your decision, West Virginia. Thank you so much.